First of all, happy Vesak Day to everybody who celebrate Vesak Day as well. Thank you for all to join us. We have some house rule. Do kindly mute your audio so that there's no distractions. If you have any questions, you can type in the chat group, or you can save it for later. Okay. So the objective of these collaborations between People Association, SUSS, Gerontology Programme, and Sport SG. So because from PA's perspective, all the CC classes has been suspended during this circuit breaker period. And PA would like to continue the engagement with the community through this visual platform. So the outcome is really to help us to continue to learn, to enrich ourselves, and to continue to inspire and motivate through sharing by expert speaker. By the way, my name is Sally. I'm from SUSS alumni, so I'm your host today. Let me introduce our speaker, Isaiah Chong. He is the founder of Proage, a President's Challenge Social Enterprise Award recipient, awardee for Singapore 10 Outstanding Young Person Award. He is a clinical exercise physiologist and a social entrepreneur who has been working with seniors for 12 years. His passion to see seniors age well and help them to leverage on his experience to bring positive change. Isaiah was a founding member of Task Force Exercise is Medicine at Changi General Hospital, a member in Senior Empowerment Committee at National Council of Social Service, and also a member of International Council of Active Aging based in Vancouver. Okay, let's welcome Isaiah Chong to share his topic on how to lead a longer, happier, and healthy life. Here we go.
Thanks, Sally. Appreciate the nice introduction. By the way, Sally is an occupational therapist. She'll be a great co-host for this afternoon. So we get to know her as well as we go along. All right, okay. So I'm just going to start right off. We're going to do, I have a few slides and some content to share. Hope to make it as interactive as possible. I understand that there may be a lot of questions. We're really open to have any questions. If you have any questions, just unmute yourself and please shoot, or you can just use the chat. Happy to answer that. And we're going to do a mini poll as well later on. So let's go. All right. Is everyone okay? Can everyone say yes, hi?
Or just wave.
Yes.
Because most of them wave, mute.
Yes.
Yeah.
Hi. Good to see all of you. Yeah, I understand everyone is cooped up at home right now. So glad they're here to be able to learn more together as a community. Okay, so today, what are you going to expect? I'm really going to share the heart of what I do. And maybe I'll start off. I've been working with seniors for the last 12 years. And my whole aim is to help seniors to live longer and healthier lives. And that is something that I've seen many seniors not able to attain to. And many of my seniors that I've met, they would tell me, si kao ho la, in Hokkien means die better la, or they are quite negative. But so here and there you get certain bright sparks, and that's where I start to learn from seniors, negative as well as positive. And today I hope to share you some of my learnings and gleanings from seniors, as well as from a huge range of research body that has been already in place right now that we often fail to put into place. All right, and so today, by the end of the session, my hope is that you'll be able to put together a simple plan and to have the motivation to be able to lay hold of a healthier and happier life for yourself and also for seniors around you, perhaps your own family members, your siblings, or your parents if you are younger and in this room. Right, so I'm just going to put up my slide. Let me just share screen. All right, could you see my screen? Just want to check.
Yes.
Alrighty, great.
Yes,
okay,
yes.
so let me just start. Yeah, so just quick introduction of what I do. As I mentioned, I'm all about helping people to lead longer, healthier lives. I've been working with the government agencies for some time. Here you see seniors in Active SG. So we have some programs in Active SG. We look at national campaigns and national programs to enable seniors to attain to better health. We are in corporates as well, so some of you could be working. You may have met us before within the workplace to ensure that as seniors grow older, as people grow older in the workforce, the maturing workforce, they'll be continually being able to work if they want to. And of course, lastly, we are always partnering individuals. Here you see two ladies holding on to some elastic, interesting weights. Those are 6 kg kind of weights that we use to train seniors to grow new muscles. Yeah, so my joy is really to see seniors get stronger and stronger as an exercise physiologist. Okay, that's pretty much what my company does and what we do. Yeah, today let's explore how old age and what it means to you. Learn practical ways to kickstart a desirable aging journey, and some longevity tips. Just a sample, because the time is short. I really want to open the time for more questions, so I'll not load you with too much content, all right? And of course, then open conversations. But before that, I'm going to start off with a quick video, just as an appetizer to get everyone warmed up. I understand the sound is a bit loud, so you may want to lower it down if it's too loud, yeah?
Papà, ma dove stai andando che ti stai vestendo?
Vado a prendermi un caffè?
Papà, dove? Non sono chiusi i caffè, non hai capito?
Come sono chiusi?
Sì, è
Vado
tutto
a prendermi
chiuso.
un caffè.
No, papà, non puoi uscire.
No, esco a prendermi un caffè, sono stanco e stufo.
No, non puoi uscire,
No, vado
papà.
a prendere un caffè, ciao.
Dove vai?
Vado a prendermi un caffè.
E tanto è tutto chiuso.
Scusi, è aperto il bar?
Sì, prego.
Si può avere un caffè?
Va bene, subito.
Grazie.
Okay, so yeah, I think if you first time I watched that, it was really funny to me because I think many seniors as they stay at home, they are trying their best to make the best of the situation, and I'm sure all of us as we are at home, we are trying to make the best situation, and sometimes some humor, some role playing would be really fun to really make every moment positive as we move along in our lives. And just for start, I like to do reflections because reflection is something that helps us to think and help us to stop, because sometimes life just goes on. And at this point of time, I would like you to think in your mind, right? This simple sentence to complete it. When I grow old, I would like to. Maybe you'll be thinking, what is old? A lot of my participants ask me, so what's old? It really depends on what you think is old. Could be 80, could be 60. It really doesn't matter. But as at the point of time we think that you're old, what would you like to do? Yeah. Some of us will maybe you'll be thinking in your mind, I would like to travel around the world. I would like to spend time with my family. So I have people that mentioned to me, I want to travel to China and climb the Great Wall of China, or climb a mountain. Some people can be quite simple. They would like to maybe start a new hobby, or do that new sport, or learn a new language. Something that's simple, right? Something that's not as adventurous perhaps. Everyone is different. But of the many people that I've met and asked this question, many people have aspirations in them. So if you're not thought about something, I'm sure something has come to your mind before. Where you have a dream or aspiration, hold that in your thought. All right. At this moment, I would like to do a simple poll, and you will see a poll come out before you about old age. So as I mentioned, we want to explore old age because what we think is important, and I will hope to get some feedback from the audience as well. So when this word old age comes before you, what do you think? Immediately, what's the first thing that you think about? And what have you heard? All right, there'll be some poll suggestions that have been gathered from the hundreds or thousands of people that I have met up before and heard from. So maybe you can check that off.
So we can take a few minutes to read through. Old age, what do you think? Maybe you can click, then we'll see the result in a while.
Yep.
Can we click more than one?
Click what's first off your mind, something that you can relate most.
Yeah, I know. What I mean is, can we click more than one or just one?
Just one.
Yeah.
Just one.
Yeah. So just try to click what comes to your mind first when you think about old age. All right. Shall we look at the results?
Interesting result.
Okay. Great. All right. Are there any more results coming? No more, right? Okay, good. Yeah. Very interesting results here. Usually in my sessions, you would see that negative stuff would be what people usually write first. Maybe because we are on an online platform, people get to see the choice and they kind of filter to the positive one. Or maybe I'm in a really positive group. But most of the time, when I have audiences, people would select negative ones, right? Of course, due to constraints of online platform, I think different people are clicking. But what I'm seeing is that glad to see most of the people are clicking on wisdom. That's definitely something that we see from seniors. Some of people say great, really good. Aging is good. I see also sickness as number 2. I'm quite surprised no one clicked the first one. Maybe it's too repulsive on useless. In my sessions, people are plain and straight blank to my face. You know, people would put that write that down. And most of the groups will actually have that. So these are the compilation of what people are saying to me, whether it's young or older people. So I'm glad to be in the midst of a whole group of audience that are highly positive and focused on wisdom. My assumption is also that maybe I'm with a lot of older people themselves, right? Baby boomers that are really looking at wisdom, and definitely agree. Older people have so much potential, so much dreams, and that's why I've been telling the older people that I meet that each one of you have dreams, each one of you have potential and aspirations. And a lot of times when we explore old age, what comes to mind is negative. And we hope to change that narrative in society. And as more and more people start to think of aging as something that's positive, we will be able to then see more possibilities down the road, right? Okay, so thanks so much for your inputs. Glad to hear from all of you. Let me just get back to my sharing. Okay. These are interesting pictures. The left side is an auntie that I met in Perth. Really, 89 years old auntie. She used to be a ballerina. She managed to maintain her flexibility. I'm sure that in this room, not one person can do what she's doing, even myself included. This is not, in a sense, superhuman strength or superhuman flexibility. Every one of us can attain to this if we're healthy, right? We are able to stretch, and the body has been created amazingly, right? Even look at the guy on the right, right? Muscular and strong and still sprightly. There's an uncle that I met, Uncle Kim, right? I met him at a daycare center. He was there not because he needed to be there. He was there because he was very sweet. He's there every day with his wife who has dementia. And he is one guy that went around to share with many seniors about his own journey from being frail to being stronger again. And I couldn't help but do a bicycle kind of photo with him because he's such an inspiration, such a role model. And every day he goes around telling the seniors over there that, don't despair, that there are better days, and even though his wife has dementia, he's still continually engaging her, and this is amazing because I see that resilience. And if one thing that you want to take away for today about growing old well and being happy in your older years, it's psychological resilience. One of my friend, Dr. Angelique Chan, who works at Duke and NUS, she's a researcher. She found that seniors who are psychologically resilient would be able to be happy, much happier when they grow older. And what do we mean by psychological resilience? That means that you're able to bounce back from adversity, right? So that means if you go through certain tough times, you may perhaps experience a spouse passing away, but you're able to bounce back from adversity. And that is something that would be able to be a predictor of happiness as we grow older. The other part to it is physiological, right? We have bones. We are made out of bones, muscle, tissues, and this is two different images, right, of a bone scan, of bone structure. And as you can see, one is relatively strong, the other one is relatively brittle. As you can see from the brittleness and the different minor fractures that you see on the bone structure itself. Interestingly, one is of a woman that's 75 years old, and the other one is a woman that's 47. She has osteoporosis, but I've known many younger people who have not osteoporosis, but osteopenia, one step before osteoporosis. Basically, they have really brittle bones. They are likely usually quite skinny, and their bones are brittle. But the interesting thing that as I work with people, even younger and older people who have low bone mass, we bring them through a regime. Every time you have osteopenia or osteoporosis, the first thing the doctor would do is prescribe you with calcium and vitamin D. But not only that, they'll ask you to do weight-bearing exercises. And weight-bearing exercises, a lot of people don't understand that. They just want to take calcium and they hope the bones will improve. The bone will not improve without weight-bearing exercises. That means that your bone has to be stimulated by force. There has to be a certain amount of weight that's put on it. So as much as you are putting weight on your muscles and your bones, that will stimulate it to grow. And the calcium is the nutrients that would actually help it to be the building blocks to continue to build your bone. And as you stimulate your bone, the processes in the bones will start to form more bone structures, right? It's not very drastic, but in terms from my clients that I work with, we have managed to slow down and even reverse bone mass density. That means day one, they have a certain amount of bone mass that's scanned in the hospital. 6 months down the road, we see a slight improvement. And studies have shown you can improve it by 2 to 3%. So not only are you slowing it down, you are actually reversing it. So that's something that it's very possible within the realms of possibility. Yeah. So if today you have certain bone issues, remember bone bearing exercises, right? Which also mean a little bit of hopping, right? That's what I mean by some bone bearing, right? There's supposed to be certain impact that goes through your bones. I'm not talking about jumping from high and stuff like that. That may cause the bones to fracture, but hopping, brisk walking, doing resistance training, carrying some weights, this will actually load your bone to cause it to grow, right? Why am I sharing all this is because I just want to share that there is so much hope. There's so much out there that could help us to age well, and I want to enable you to be able to put all this together. Yes, yeah, I have a question. Oh, no, okay. Let me just carry on now. So this news just came out the other day, and from the news you can see that this 102-year-old lady in Singapore, she survived COVID, right? And if you look at the interviews, you can see that she is highly resilient, right? Highly resilient, as I mentioned, there's psychologically resilient. From the interviews, they say that she's fiercely independent. She fights for her independence. She bathes herself, even though she lives in nursing homes. She walks around each day. That means that this lady has not given up hope. That means this lady is still doing something that continues to keep her. And I believe that with her condition, right, she's able to overcome that. She's built enough reserve in her to overcome even COVID virus. So that's something that is so amazing. And in my journeys, I've met many people, the rich and even the poor, those living in rental flats, that continue to be healthy and resilient. So even as we're talking about thinking positive about aging just now, the good news is for all of you who are thinking positive about aging, that if you think positive about aging, your satisfaction goes up, right? Your sense of happiness goes up. Your sense of usefulness goes up. Your energy goes up. And what does all this translate to? It translates to an increase of healthy years, right? In Singapore, we live the longest in the whole world, right? Let me repeat that. In Singapore, our life expectancy, or we live the longest from birth. Against all countries, we live the longest, right? But we have about 12 to 13 years of unhealthy life, right? Means from 70 plus up to 80 plus, we are usually unhealthy or we are with disability, right? But if we think we don't even need to do anything. We just need to be able to think positively, have a positive mindset about aging. We can increase our healthy years by 7.5 years. How amazing is that? And this is a long-term research that's been done by Dr. Levy in Yale University. This, in comparison to somebody who has no high blood pressure, no high cholesterol, is only 4 years. And to me, this is the fastest, quickest way to help us to age with health and happiness, right? It's about how you think. It's about what's your perception towards aging, and this is what I actually tell all the younger people as well that I meet, that hey, how you think about your grandparents, how you think about older people matters, because it's going to impact how well you age down the road, right? This predicts actually how you will age. All right, I'll just move on quickly from this because end of the day, when we look at old age, this is what most seniors hope for, right? We want to not be a burden. We want to age well because we don't want to have as much suffering. We're going to do what we want to be able to do to feel fulfilled in our lives, and to be able to share and to give, to love others, and also to receive that. All right? So this is what encapsulates what we hope for. But if you want all that, the important thing for us is that we need to plan. So far as in my knowledge, as I work with different people, we have financial planning, we have health planning, we have various different planning, and we have planning for when we are children, you know, what do we want to study, you know, our careers, etc. But nobody planned to grow old. We plan to grow up, but we never plan to grow old. And this is something that I just want to put before you today. I just humbly put it before you, because I've seen too many seniors, right, suffering from the ill effects of not planning. And I've also seen research of people in nursing homes, right? When we ask them, you know, if we can turn back time, what we want to do more? They said they want to reflect more. They want to be able to plan and do something that they've always aspired to do. And all that starts with planning. You know, so today I just want to encourage all of us, number one, to decide to have a plan to grow old. Write it down, plan it out. There are many different ways of looking at it. We can start by reflecting on what's important to you. Is it family members? Is it your health? Some things I mentioned just now. Is it not suffering or to be loved? If you want to be loved and love others, then it's the relationships perhaps that you need to look at, right? To have good support around you, that you can support others, and of course others giving support as well. The other thing that's quite interesting is social connectedness, right? How connected we are. And that's about investing into relationships, right? So we need to plan, we need to know what's important to us and plan towards action and stock take that on an annual basis. Of course, there's a lot of details that we can go into this, which I can't share today, but I think I give you a sense of what we need to do in the next chart. Right, this is what we use in Proage to walk along with seniors, walk along maybe also with even with people who are middle age, about 40s, 50s, you know, and there are different areas. And this model or process is developed by looking at different longevity studies, where scientists go around the whole world and look at pockets of people who live long and live healthy and happy as well, right? And we have broken it down to various different action steps. And so the first on top is access, right? So as I mentioned just now, assessing, reflecting about what's important to you, assessing on a yearly basis where you are in your growing up plans. Assessing even means health screening. Have you taken a health screening to look at where you are at in terms of your health? What about the fitness assessment, right? So this access. Next piece is build. This is pretty much looking at how can we build an environment that is useful for us, that is helpful. So for example, as we grow older, can we build an environment that is safer, right? For example, putting bars, grab bars in the toilet. Most people fall in the toilet, that leads them to disability. So building an environment that's able to help you grow old in safely is important. Looking at if you're moving to a new place or maybe a studio apartment, ensure that you know where are perhaps even the parks and places where will help you to boost your well-being, right? So how do you build environments that are helpful in terms of helping you to age well? Next is interaction, right? Social connections, right? And where you have building social support, close relationships that you can reach out to for help. This is super important and daily, maybe even coffee chats, interacting with people young and old, not just older people, young and old, interacting. And the social relationships and interaction helps your brain improve, helps your psychological well-being, it helps your physical well-being as well. So we call it interact. Next is move, right? Moving, constantly moving. I have a slide later on that I will show. So maybe I'll just move to eat. Eat, of course, there's pretty much Health Promotion Board has very specific guidelines in terms of healthy eating. You can search so much on this area, right? But of course, if you ask me, Isaiah, what's the big one tip for eating? A lot of people that ask me that. I would say try to eat less sweet stuff. Yeah, so cutting back on eating too much and sweet stuff would go a long way. Sugar does bad stuff to bad things to our body when we take too much of it, right? So of course in moderation. Last is think, right? When you look at thinking, let me show you the next slide. Okay, let me go interaction. Okay, so I've last two slides to just share with you before we go into Q&A. Interact, right? So as I mentioned, safeguard yourself with social support, friends, family members, even younger friends, neighbors, people that you can lend support to and they support you. Engage in activities that build positive relationships, right? So even as you look for activities, look for ones that can help you build relationships, right? Friends and connections that matters in the long term. Because even as we grow older, I've heard so many older people tell me, my friend, 一個死咗啊, one by one they die, you know, and at that point, I'll be telling them, hey, you need to make friends, you need to get more friends. You don't need like 10, 20, you just need a few and continue build on that. It takes a long time. So that's where this needs to go into your plans. All right. Social acceptance. I talk about connectedness, but it's also about accepting yourself, accepting where you're at. Right. Some people could be on a wheelchair. That's where they're at. Right. Accepting that and moving on. Because sometimes when we can't accept ourselves for who we are, then we start to isolate ourselves, and that goes against interaction. Right. That goes against what successful aging is telling us. Think. I think we talked a lot about this just now, having a positive mindset, so I will not belabor the point. Maintain your cognition, okay? This is something that I'm sure everyone is interested in. The number one question people ask me, Isaiah, how do I prevent dementia? And the answer is you can't prevent dementia. You can actually slow the dementia down if you have it. The good news is that recently Proage has been involved in the last 3 years in a study that talks about cognitive impairment. That is one step before you even get dementia. Some people get cognitive impairment, right? Where their memory or different brain function goes down quite drastically. And the good news is after 3 years, we have found that you can actually reverse mild cognitive impairment, right? That is very amazing to me, because a huge percentage of Singaporeans, seniors in our country have mild cognitive impairment, right? The number is about 15 to 20% above 65, right? So that is a huge number, and to be able to reverse it is amazing. Some of these principles that we use is variety. Have as many variety as possible in terms of your activities. Next, challenge. When we look at activities that we do, for example, playing mahjong, for example, that some seniors love to do. If you have been playing mahjong for the last 10 years and it has become so easy that you touch the pie already, you can feel the pie already and know already, or maybe you can play 2 tables at one time. I've seen that before. An old auntie, she played 2 tables at one time. You know, she's in the 80s. That is not challenge anymore to our brains, right? We need to be able to challenge our brains. So, for example, maybe learning piano, learning French, something that is challenging, that will cause our brains, to push it a bit harder. That's challenge, right? That helps build new neural connections, right? Connecting our brain cells in a more elaborate and connected fashion that helps us to be able to maintain our brain functions and cognition. Lastly is novelty. Similar to even building bones or muscles. And so when we look to our brain, our body needs something that stimulates us and something that's new, something that's novel, and even if you look at the novel coronavirus now, it has caused business to change. It's caused people to start to innovate new things. And I think that's what caused our body to change, caused our brain to change when we give it new kinds of stimulation, right? So today, if none of us know how to play the violin or piano, right, and I bring you to a new experience to listen and to play and to be able to pay attention to the different tunes. It's something that's new to our brain. That's something that is good for your brain, right? So of course, the last example that I could use is learning. So even right now, as you're listening to me, maybe you're writing down notes, you're learning something new, that is already creating new neural pathways in your brain right now, at this moment. Right, that's something that's new. I think I will just stop here for now. Yep, just stop here for now and come back in to have a quick chat, question answer before I head to the last part.
Hey, Isaiah, we have some questions.
All right.
Why there's a theory that 70s age is a critical period, especially for men? Asked by
70s.
Yule.
Could you repeat the question again? I couldn't
Why
hear that.
there's a theory that 70s age is a critical period, especially for men?
70. Interesting. I've actually not heard about it in 70. What I hear is about 50s. That's the one. 50s because it's pretty much midlife, and actually a lot of divorces happen in 50s, 60s because children start to leave the house and get married, and divorce happens. So divorce the rates goes up. 70s, perhaps my assumption is 70s, perhaps they are the point where financially they may be quite strained. Friends as well might have really left, so they will start to feel lonely, so connections are starting to go down. It's also 10 years after retirement age, so after you retire, usually men get impacted the most because their pride get affected, right? Like, oh, I'm one day a manager, next day I'm nothing, I become a chauffeur. That's what they used to say, right? And that impacts how men feel about themselves, as I thought about social acceptance, right? So it impacts how men feel, and after 10 years they may be quite bored already, right? They may not feel useful anymore, and so at 70, my assumption is that, though I've not heard of the theory, but my assumption is that they would start to feel that, hey, what's life? What am I living for, right? And that would kind of start to bring them on the downhill if they are not careful. So that's where I always advocate plan. We need to be able to plan. If you want to grow old well, which I'm sure everyone wants to. In Proage, we have a belief that everyone wants to grow old well. Nobody says that I don't go well. I want to suffer and be bad. No, nobody wants. Like, everyone wants to grow old well. But the question is why none of us are really putting a concerted plan and following through on it. Yeah. So I think it's a good conversation to start off with. And yeah. Who answered that question?
Thank you. There's one Davina is asking, are there any one factor that's more important than the other that one should focus to be healthier or happier? That's a tricky question.
Yeah, if she's talking in terms of the pro-aging model, I don't think there's one thing more important than the other. It is why actually those are the aspects in which we pull out from the longevity studies. And longevity studies is basically, we are humans, right? Humans, there's so many different factors that impact us, right? And if you notice just now, everything was structured in terms of quite actionable things that we could do, and they impact different areas of our life and different systems in our body, from our emotional, our psychological, social aspects, our physical, our well-being. It impacts all different areas. So no one can say that my brain is more important than my heart, right? Both are as important. And so I don't think so from person to person, that's where we need to plan. And I believe that there needs to be coaches as well looking at this, because someone may have a good brain, but maybe socially they are not as good. So it's about how do you help this individual maybe learn how to make more friends, or maybe it's the other aspect, right, of assessment. Could they go for assessment that tell them more about themselves? So yeah, that's where I feel that yeah, every aspect is just as important, and for each individual, maybe some are more important than the other. Yeah. Thanks for the question.
Okay. We have few more. Do you want to continue your things, or we will
Yeah, just go ahead with the
start
questions.
Q&A? Okay. So how to encourage elderly to think positively, as they will just respond like when you grow older, then you'll know, etc., etc. How do you respond?
Yeah, I think inherently there are a lot of seniors that are really negative, right? And you tell them, oh yeah, do this, and say, oh yeah, can wayside lah, cannot lah. And that's the favorite key phrase, cannot. Oh, that one I hear already, I heart pain or sim kia, you know, I would say we can't change people immediately or right away. One thing I like to ask them is, you know, what are you happy about? You know, what are you grateful for? Right, start step by step. Right, could be something simple, you know, once they start listing out what they are grateful for, because gratitude is evidence-based. Once you are grateful, you start to have that habit of being grateful. You start to change, right? You start to be, you start to think about things differently. You start to be more grateful, and start to shift your perception. The other thing that I would like to ask the senior to do is to give. I work with seniors in the rental flats, and many of them are not only pragmatic, but you know, with little they will fight, and sometimes even get violent, you know. But they are such warm and loving people actually. And I remember I met an 89-year-old auntie there. You know, she lives alone, very feisty, very fierce. Everyone is scared of her. I took the courage to reach out to her, you know, and try to chit chat with her. She left me standing outside the house. Don't open the door.
Wow.
But I started talking to her, and one day she just put a bowl of tong sui and hand it out to me. You know, and then I realized that, hey, you know, giving actually helps bridge the gap. Giving actually helps people come out of their shell. And so for seniors that don't really want to get involved, for example, in a nursing home, some seniors just lie down there, just stare at you, right? How do you get them to give, right? May not be something big. Tong sui is something simple to the auntie. It could be give a smile, right? So as the auntie, xiao xiao 一下, you know, give a smile. Once they give a smile, they're giving something to somebody, and that starts a change in them, right? So it takes one step at a time. So the auntie that gave me tong sui, before long, she invited me and my whole gang into her house. No, she bought durian, she cooked a whole dinner for us. One Sunday she invited us to her house. I was really shocked, but I was really humble also, because an 89-year-old auntie, you know, living alone in a rental flat. I'm sure she's not very well off, but she cooked up a feast for us, and that was really so precious in my memory, and she has left us today, but yeah, you know, it was quite amazing,
memorable. Yeah. Thank you. We have a few more questions. Roland, he asked how to overcome depression in old age. How can we grow old gracefully?
Yeah, how to overcome depression. Wow. One thing is not everyone gets depressed when we grow. Depression is a condition. It's a medical condition. It's not something that we can think to be depressed, right? So it's a medical condition. I think in terms of overcoming depression, we need to look to the medical professionals that can work with you. However, the question I think could be phrased better is how can we prevent depression in old age? And I think the things that I shared just now about having social support, continuing to make interactions with people, accepting yourself and people, circumstances, right? Learning how to build psychological resilience. Even building exercise have shown to reverse depression. So I think this if you're able to plan and put things into action, these are the various different areas in which we can prevent depression and never allow depression to come upon us in old age, right? Yeah.
And how can we grow old gracefully?
I want to ask Roland, though, what does he mean by gracefully, because it's quite. I know everyone likes to talk about aging gracefully, but my question is always, what do you mean by gracefully, right? Yeah. Yeah. Sally, you want to say something?
Live
Go ahead.
life to the fullest. I guess you know, for me as an occupational therapist, we really focusing on engaging activities. The more you engage, the more your brain is working, the more you get distracted, the more healthier and the more happy life you have. So, and doing things you like is very important. Family support, chit-chatting, social interactions. I know now this circuit breaker is very difficult for us to go out. You know, we can find ways like WhatsApp call, Zoom call, like together to have meals together through technology. Yeah, this is the new norm at the moment that we know we have Zoom call to eat together. We tried last week with my in-law and other family member. We have like 10 people in Zoom just to chit chat and eat at the same time. I think it's something, you know, interactions is very important. Yeah.
Yep.
Okay, now we have another question from David.
How do you feel about state
How
of
do
elder
you
care?
feel about the state of elder care and aging well in Singapore? Any suggestion for improvement? How does Singapore compare to other countries in this aspect of healthy aging?
Yeah, since I started 12 years ago, Singapore has gone through leaps and bounds. I think we are very much more organized. We have done lots of overseas studies from countries far away like Finland to Australia and Hong Kong and different places. I myself have done those trips to even Japan. Singapore definitely is doing well. We used to even be behind Hong Kong, but we have overtaken them. Right? I think in terms of what we are doing, we are I would say we are quite one of the top around the world. But of course, we are very, very different. We cannot compare the elder care in Finland or Australia, where they have like huge retirement villages and all sorts of stuff, with Singapore, because we are a different country. Our makeup is different, and our people are also different, and how people live are also different. And I think the government's approach is definitely different. But in terms of how we are set up, in terms of outcomes, I would say we are doing much better than 12 years ago when I first started. But in terms of improvement, I would think that outcomes in nursing homes, I think nursing homes can definitely be further improved. How we tackle social isolation and seniors getting online, digital, I think definitely can be improved as well. And intergenerational engagement is the other aspect that I think about a lot, because a lot of the intergenerational activities right now are not going deep enough, and I think that there can be more concerted effort in the area to build intergenerational bonds between grandparents and children, and even to their own children. So it's 3 generation or 4 generation, right? And building that within the entire community. So an older person maybe being friends with a neighbor next door that is a youth, right? So that is something that I think can be further strengthened. And some people like to say that's the kampong spirit kind of thing, right? And definitely that's something that we can improve upon, because that has well-being and impact to aging as a nation. The other area for aging will be in the workforce. How can we help mature adults in the workforce continue to work, continue to be productive throughout their lives? Because if we live the longest, we have a good 20 years, from retirement to our end of life, right? And that 20 years, how can we envision ourselves as a nation to age better during those 20 years, to be more productive, to be more to create more significant impact in their life. And of course, this is all down to personal choice as well. But to me, from a national policy level, I think that there is much we can do, and also a lot of ground initiatives that can support this area. Right. So Hope I answered that question. I have another question that is sent to me privately. Is someone mentioned about how long and how much weight-bearing exercises one should do a week. Right, I would suggest when we look at exercise, we have weight-bearing exercise that I would say is pretty much we can do it during the same time as we do strength training. So I would say within 1 week, if you're doing brisk walking, that's really weight-bearing, right? Brisk walking 2-3 times a week, you'll be doing brisk walking. The next 2 or 3 times a week, you can go downstairs, you do some strengthening by doing squats, right? Maybe a little hopping on the spot.
A bit of weight also.
Yeah,
a bit of weight is
weight.
good because when you're in certain age, your muscle might be wasting. So it's important to integrate a little bit of weight, just gentle one, or go to the park to do the exercise that the government actually provide. I mean, now we can't do it. So what I usually suggest my client, you just get some water bottle, fill in some water, then make it 1 liter and then just carry it for like 10 times, 3 sets. Yeah, so this is part of that weight training.
Yeah. So, but when I mean weight bearing, right, it means there has to be significant weight on ourselves, right? That goes to our bone, right? Usually in our sessions, we will actually put on weight. So just now you saw that blue thing, right? That 6 kg. We actually put it on seniors and get them to hop, right? So you can imagine that amount of weight, right? That's loaded on the person, and that's what you do. If some people do light skipping, that's great as well, because you're giving impact, and we want to start to impact the bones that matter. For example, like near the hip, where you when you fall down, you will not want to have a hip fracture, because that causes disability, and even 1/4 actually would pass away. And so you want to strengthen the parts of your body, the bones that are actually vulnerable. Yeah. So when you start doing skipping and jumping, for example, that will be a great start. So do it twice a week. I would say for a good minimum 10 minutes. Yeah. Okay.
That's all for the questions. Isaiah, do you have any other things to add on from my slides?
Yeah. So let me just share screen for last time. Alrighty. Okay. So yeah, I just want to end off with the key beliefs. Just to wrap up with, this session. So we believe that everyone has a potential to age well, right? So if today you're thinking, maybe it's not for me, or I think that somebody I know quite tough, erase that. Okay, number one is that everyone has the potential. Everyone has the potential. You have dreams in you, aspirations in you. You are able to age well. And some people may say, hey, Isaiah, what about that person who is on a wheelchair, got stroke, how? And to me, look at the strength of the person. We need to look at strengths and not the weaknesses. Oftentimes we look at weaknesses, and for that person on a wheelchair, I know people with cancer, I know people on a wheelchair who are also really aging well, man. So in that context, in that circumstance, look at the strength, look at the potential, and develop that. Number 2, aging is a journey you can optimize, and as I mentioned just now, we will need to plan. We will need to decide today to plan, reflect on what's important, put things on paper, and then review it on an annual basis. This journey can be optimized, and it's a long journey ahead, but enjoy it, because as we grow older, that's the prime time for our lives. Aging is how we think it to be. I think we stress a lot of this in terms of mindset, having a positive mindset, and aging is really how we think it to be. And you see that happen to many people, if it's negative and as well as positive. Lastly, aging can benefit others, and this is what I like about aging, that there's so much that older people can give to society. There's so much that older people can give to themselves and people around them. So aging can benefit others around us. All right. So yeah, just my end off is really go for a mountain, go climb that mountain and go for that whatever that you have aspired to do, even in your younger days. If you go for it, go forth and live in the prime time of your life, right? And just a shout out on Facebook. Feel free to join us on Facebook, and we have a complimentary cognitive assessment that you can take on our website. I think it's posted up already. Just go for it and pick it up, right? And so that it's facebook.com/proagesg, right? That's about it for me. That's all I have. Happy to take questions and before we end off.
Any more questions? Maybe before we end, I would like to ask Isaiah one questions.
Sure.
So when older adults say that they don't want to be a burden, how you respond to them?
Yeah, I think when older people mention that they don't want to be burdened, largely is in relation to finances. I will always start by encouraging them and asking them what do they mean by burden. Oftentimes seniors want to be heard, and they don't want to just for you to solve the issue for them. They want to be heard, and as you hear them, they will then be able to open up to what exactly is the issue that they are referring to, and from there we can then take it step by step. As older people, they need to be able to hear step 1, step 2, step 3, clear path, right? And so after listening, we can then start to suggest specific thing. Maybe is to speak to their own children. Maybe is to suggest an outlet, right? So that's what I'll do. I'll listen, and then I would try to suggest a few steps for them to take, and they have to be empowered to take that step themselves, not for us to make a decision. And oftentimes we are very fast to make decisions for them and say, okay, let's do this, right? And we disempower them, and we do not give them the autonomy to make those decisions, and that actually breeds dependence as well.
Thank you, Isaiah. Glad to meet everyone. Thank you everybody to stay on for these sessions, and we're looking forward to serve older adults and caregivers in our community together. Tomorrow there's a last session, 4 o'clock. There's a topic of positivity through the generations. This sharing will be very interesting because it's by father and daughter's duo, Mrs. Thomas Kwan and Miss Carol Kwan, who will be sharing tips on building happiness and positivity within the family amidst in this current situation. So thank you everyone again. Not forgetting the public message such as stay home, maintain social distancing, wear a mask when you need to leave the house, and go home after running or do any essential errands. Last but not least, please check out more upcoming virtual sessions organized by PA or Facebook or SUSS. Thank you, everybody. Stay safe.
Thank you.
Bye. Thank you.
Take care.